morning, ladies and gentlemen. My name is Teresa Reyes,
And my name is Aric Garza.
and together we conducted some research on the psychology of students entering the medical field during the COVID-19 pandemic. So first of all, a little background on the COVID-19 pandemic. So as we know, we've been dealing with this for almost a year. This originated in Wuhan, China in December of last year. It is a strain of the flu that we haven't seen before, and it has caused a worldwide pandemic, as we all know by now. So due to this pandemic, there has been a lot of issues kind of arising from the healthcare system that we have seen in the news. There's a major need for medical professionals to be taking care of patients. So we have been seeing that some students have been released early from their programs to go into the work field, and they're starting very soon with sometimes little patient experience. So we wanted to see with medical students how they feel about this, since, you know, this is a very serious medical professional is a very serious profession to go into. So I wanted to see how medical students were feeling with their stress levels and anxiety levels, with like less in-person lectures and maybe even less clinical hours. And as we know, class has also been moved to only online. So not only have there been restrictions on students going and getting their clinical hours, but now students sometimes cannot even go to the school to get hands-on experience.
Just as my partner Teresa had said, we had based most of our research on these questions, and we fortified our foundations with this purpose of research. So, seeing the following that Teresa had said, we were trying to see how and why the medical professions and students had gone through, and which obstacles they gone through, and how they coped with them, and see how they did it, how they were doing mentally, how they were doing physically, and which strategies they used to cope with it. So our purpose of this research was to visualize and analyze how and why COVID-19 impacted medical students. And the following questions you see here were mostly the questions we used to conduct most of our research. Next slide, please. The methods we used and materials were mostly SurveyMonkey and Zoom meetings. In the near future, mostly in spring, we plan on using more interviews and one-on-one Zoom meetings with some of these healthcare students and maybe even healthcare professionals later in the spring, to see what else we can kind of gather from how COVID-19 impacted these professions. I'd like to give a special thanks to everyone in the LEAPS department. Big special thanks to Dr. Nora Garza, to Ms. Agüero, and Mrs. Solis. And I'd like to give my thanks to Sonia Ortiz, my mentor, and my faculty mentor, Dr. Laura Lopez. And here are the following references we used. Feel free to look after them if you need more materials on how and why we got most of our information. As you can see, we have a lot, so you can feel free and go ahead and see it. Thank you, and this has been a project based on how COVID-19 impacted medical students and professions.